Hello, and welcome to today's webinar entitled Chiropractic and Low-Level Laser Therapy for Neck and Back Pain. I'm Dr. David Kanashko. I'm a chiropractor. I work for Meditech International Rehabilitation here in Toronto. We also manufacture the BioFlex Laser Therapy series of low-level laser therapy equipment. Today's lecture is geared towards chiropractors, obviously, and how low-level laser therapy can enhance the treatment of different conditions for neck and back pain. I want to give you a bit of a background of myself and the company before we get started. I'm a graduate in 1992 from CMCC here in Toronto. I was actually had a serious leg injury myself about 4 or 5 years ago. I had to stop the practice, and I ended up seeking treatment from Dr. Fred Kahn. He's the physician and CEO of the company. And I was amazed at how well it worked with respect to my injury. I actually had a complete tear of my gastrocnemius playing basketball. And I was so amazed that I decided to sort of spend some volunteer time just observing patients and seeing how other types of conditions responded to laser therapy. My background is in molecular biology and molecular genetics, and it got me interested in trying to understand the mechanisms of how laser therapy works. And it got me looking at the research and so forth. And currently now I actually work full time with Dr. Fred Kahn at the clinic here in Toronto. We also actually have two clinics in Toronto, one in the West End and one in downtown. I also maintain a private practice as well. So let's get started. As far as coverage for today's webinar, I want to talk a bit about the physiological effects of low-level laser therapy, about pain control and how that can be induced using laser therapy, manipulation and low-level laser therapy contraindications, neck pain. Specifically, I'll talk a bit about cervical facet syndrome. I'll talk about some research that combines chiropractic and laser therapy care. I'll talk a bit about whiplash or acceleration-deceleration syndrome. And going into the lower back, I'll discuss how laser therapy can help nerve root compression. And lastly, I talk a bit about some evidence-based guidelines that have come up over the last few years to show the efficacy of laser therapy. Okay, so let's talk a bit about the physiological effects of laser therapy. The first thing I want to mention was angiogenesis and neovascularization. There's two ways that laser therapy can help induce increased circulation around the area that you're treating. One is of a temporary nature, and that's by the release of nitric oxide into the tissues and the blood vessels, causing temporary vasodilation. On a long-term approach using laser therapy, you can actually induce branches of capillaries in and around the injured area with using laser therapy. This is actually accomplished by the stimulation of endothelial cells that actually undergo increased level of mitosis and turnover, and thereby actually forming new branches of capillaries. So obviously this is really important when you're increasing the ability of the tissue that you're treating and that's healing to have an increased vascularity, because this will enhance and accelerate the healing aspect. Collagen production is also well known to be induced by laser therapy. This is really important because when you're dealing with soft tissue injuries, whether that's ligamentous, tendinous, muscular, so forth, the scar tissue that's being laid down and the ongoing repair and remodeling of the tissue has to do obviously with collagen being produced and laid down by localized fibroblasts. And we know that typically there's a much higher percentage of type 1 collagen compared to type 3 collagen in tissues like tendons and ligaments. And this is important because type 1 collagen is much stronger, has a higher tensile strength, less prone to being injured. We know that laser therapy, through the research, can actually induce more type 1 to form than type 3 collagen. Type 3 being immature collagen that tends to predominate scar tissue and can often linger and be a higher percentage than normal, which is about 5% in these tissues. So the higher percentage of type 3 means that the tissue is actually weaker, is less elastic and more prone to being re-injured. So by adding laser therapy to the tissues that you're treating can actually help to make the tissue stronger because of the collagen and the type of collagen production. Laser therapy also can play a role in muscle regeneration and muscle atrophy. Specifically, research has indicated that light therapy can induce stem cells or myosatellite cells on muscle fibers that are injured to increase the numbers available for repair and regeneration of muscle fibers. And I'll talk a bit about some of the research and some examples of this as we proceed today. Inflammation, edema, and pain is all it can all be modulated using light therapy. Specifically, light therapy is known to have an effect on white blood cells that helps to modulate the cytokines and chemical mediators of inflammation, also controlling edema and having an effect on pain as well. So it's a very potent anti-inflammatory and analgesic form of therapy. Nerve regeneration is also impacted by laser therapy. Specifically, Schwann cells are stimulated. There's more nerve sprouting, and the potential for nerve repair using laser therapy is essentially accelerated when you use this type of therapy. Cartilage production is also known to be modulated by laser therapy. Specifically, chondrocytes are known to be stimulated, thereby actually improving the density and thickness of articular cartilage in degenerative conditions like osteoarthritis and rheumatoid arthritis. And finally, bone formation. We oftentimes treat bone fractures here at our clinic, everything from stress fractures, compression fractures, and other types of bone osseous fractures in order to stimulate the bone cells, osteocytes, osteoblasts, and osteoclasts, and actually helps to modulate the ability of these cells to repair the bone much faster than normal. Okay, so in a nutshell, these are all the potential physiological effects that you would see if you incorporate laser therapy. There we go. So the wound healing stages. We know this is a review for everyone listening in of the different stages that occur if you have tissue damage. So for example, say you have a muscle ligamentous tear in and around the spine, for example. Initially, you have vasoconstriction followed by coagulation, then vasodilation in the initial phases of the first few minutes of the injury. And then, of course, you get into the inflammatory phase where you have neutrophils predominant, and followed by proliferative phase, and where you have fibroplasia and granulation tissue being formed, epithelialization, angiogenesis, contraction of the tissue, and you start to get macrophages being the predominant cell, which are critical because the increased number of macrophages means that you'll have an enhanced repair aspect to that, meaning that the macrophages help clear out dead and dying neutrophils and bacteria and viruses, and actually help to control and modulate inflammation. So they're very critical in the later stages of inflammation. And as remodeling occurs over maturation of the tissues, that can occur over weeks to months. So eventually you end up with the remodeled tissue, which oftentimes tends to be weaker than at the very prior to the actual injury. So if you look at the time frame for these wound healing stages, you can actually see that it occurs over days, weeks, months, and even sometimes up to years. It's really critical to understand that what you're trying to do with your patients is decrease this wound healing stage. So your patients that are coming in that have just strained muscles in their lower back or their neck or other types of tissues around their spine, your job is to help to speed up the wound healing stage. Now we know that there's different ways of doing this mechanically using your hands, manipulation, mobilization, exercises, those kinds of things. At the same time, laser therapy has a great impact on the wound healing stages. And that's what this next slide I wanted to point out. So what you're looking at here are all the different, and this is just a few of the research articles done on the different stages of wound healing. So you can actually see that laser therapy has a role and actually a positive role on all the different aspects of those wound healing stages. So everything from the proliferative phase to inflammation to fibroblast proliferation and collagen formation, wound contraction, angiogenesis, and so forth. Laser therapy all has a positive effect on these specific stages in wound healing. So that actually accelerates the entire process so that your wound healing will be much shorter than if you did not use laser therapy. Okay, so let's talk a bit about pain control and the use of laser therapy. As chiropractors, we know that manipulation, and for that matter, certain types of mobilization, is very beneficial in providing patients analgesia and pain relief. And part of that reason, of course, has to do with things like the release of endogenous opioids and so forth. The research has indicated laser therapy can also play a key role in helping control pain in your patients. And of course, that's critical when they present in an acute presentation. So we know that laser therapy can decrease substance P and bradykinins, COX-2 and prostaglandin levels, and these are all known noxious stimulators. Laser therapy can also disrupt fast axonal transport in small diameter pain nerve fibers. So A delta and C fibers can be temporarily inhibited using laser therapy. So very similarly to, say, using IFC or TENS, you can use laser therapy to block the pain fibers in a temporary fashion to help induce analgesia. And this is really important when patients are coming in and you can't do physical or manual therapy on them. Laser therapy is also known to help chronic pain. Specifically, it can help to reduce central sensitization with repeated laser therapy treatments. Okay, laser therapies can also induce endogenous opioids. Specifically, the white blood cells that are stimulated in the area of the inflammation or the area of tissue damage are released, and they're stimulated to actually secrete a greater quantity of endogenous opioids, and of course, therefore, providing again a sense of temporary analgesia for your patient. So this is really important to provide relief for your patients at the first visit. There are some contraindications to laser therapy, and I want to talk a bit about those. But specifically, I also want to talk a bit about the contraindications to manipulation where you're looking for other alternatives or other options to treat those patients. So for laser therapy, some of the contraindications, for example, have to do with treating during pregnancy, specifically over the womb and the lumbosacral region during pregnancy. Although there's no concrete evidence that this can have a negative impact on the fetus, we actually still want to be cautious with respect to this, and we try and avoid treating that area. So it would be an example here where manipulation might be a better approach than, say, laser therapy in this case, because obviously we don't want to do manipulation, or sorry, we don't want to do laser therapy during pregnancy over that lumbosacral region. Directly over a site of malignancy. So for example, if a patient has a known, say, metastasis from the prostate gland, for example, into the lumbar spine, obviously it's contraindicated not only for laser therapy but for manipulation as well. Direct laser irradiation to the eye. And one of the great benefits of bioflex laser therapy is that it combines both lasers, laser diode treatment, and superluminous diodes or high-powered LEDs. The reason for this is that the LEDs, number one, can cover a much larger surface area and blood, which is critical when you're treating these types of conditions. But also, too, they tend to be also very safe because there is no contraindication to that light directly going into the eye. For the laser portion of bioflex laser therapy, we tend to, or we not tend, but we must use protective goggles to protect both the patient and the clinician performing the laser therapy portion of the treatment. And this has to do with the fact that the light can actually cause damage to the retina if it's held directly into the eye for a certain length of time. We also want to avoid direct irradiation to the thyroid gland. This may cause increased activity. So when we're treating, say for example, this sternocleidomastoid, maybe the anterior scaleni, or the anterior portion of the neck, we need to be careful with laser therapy and not to directly place that light over the thyroid gland for any period of time. So other than that, there really aren't many contraindications for laser therapy. And that's one of the huge advantages of having this type of treatment available to your patients at your office, because you can safely use it without fear of actually harming your patient or potentially harming your patient. And you know, it takes a lot of that risk away for those types of patients that I'll talk about next. So, for example, patients that have significant or severe inflammatory arthritic conditions like rheumatoid arthritis, especially in the neck, or seronegative spondyloarthropathies, such as acute AS, which is characterized having episodes of acute inflammation, or if there's significant demineralization of the spine, ligamentous laxity with anatomic subluxation or dislocation. These, of course, would all be absolute contraindications for manipulation, and you'd be looking for different or alternative ways of treating these patients. So laser therapy is not contraindicated for these specific conditions and can be a great adjunct for other types of things that you may be doing for these patients already. For example, maybe you're doing acupuncture or other types of modalities. Laser therapy is shown to be extremely effective for these types of conditions, and I'll talk a bit about that as we move forward. There we go. Okay, some other contraindications for manipulation. For example, any pathologies resulting in bone, joint, and ligament weakening or malformation, where there's, for example, moderate or severe sprains and strains in the spine, acute or unhealed cervical and/or lumbar spinal fractures, congenital disorders, for example, osteodentortium, or things like ossification of the posterior longitudinal ligament. These are all, again, absolute contraindications for manipulation and can be safely used and treated with laser therapy. So you can see this is just a few of the specific types of conditions that you need to be extremely careful about using manipulation, whereas laser therapy can be a great way to treat these patients without any fear of harming them at all. Next, I want to talk a bit about neck pain. So specifically, I want to talk a bit about cervical facet syndrome. So we know that neck pain and facet joint involvement is relatively high. Anywhere from 1/3 to 2/3 of patients that have neck pain will have facet joint involvement. You can see the references here. As I move forward, I'll mention a lot of different papers. These will all be mailed out to you upon request, so that you can have them and take a look at them if you wish. So we know facet joints are diarthrodial-synovial joints with fibrous capsules that are richly innervated by both proprioceptive and nociceptive fibers. Different causes for facet injury, for example, arthritic destruction of the synovial joints, trauma, for example, secondary to, say, whiplash or sports injuries, repetitive strain or stress on the facet joint, so repeated or prolonged cervical extension in certain occupations can eventually cause irritation of the facet joints. And things like anterior listhesis, spondylolisthesis, and so forth can also cause increased stress to the facet joint. As far as the signs and symptoms go, we know that there's tenderness with palpation of the facet joints and typically the paraspinal muscles located in the area. There's typically referred pain in the region around the neck and the shoulder girdle area. There's oftentimes pain with cervical extension or rotation, so you'll see a positive Kemp's and or Ruth Jackson sign. And one of the key findings is the lack of neurological signs. So these are all the typical signs and symptoms that you'd see with facet syndrome. As far as location goes, again, obviously a review. We know that the facet joints are 2.5 centimeters lateral to the midline in the back of the neck. This is really important for laser therapy specifically because when you're treating it with a laser probe especially, you want to make sure that probe is directly overlying the facet joints. So as a skilled chiropractor, you obviously know how to find the different areas of the spine. It's no different, and you need to use those palpation skills when you're using laser therapy, because if that light isn't being directed to the area of pathology that you're trying to treat, then really it's not going to do much good. So one point I want to raise is that when you are treating patients of an arthritic nature in the neck, it's important to focus that light, the laser therapy, over the C5 and C6 joints, because those tend to be the most involved with osteoarthritis. Okay, so a few pointers with respect to using laser therapy on neck conditions. One of the most important things to remember is you need to get the light into the tissues that you're treating. So it's really the therapeutic dose that you need to achieve at a certain depth, that lies at a certain depth that you're trying to attack. So it's best to have a pressure contact technique. This enhances the penetration depth but bringing the actual probe itself closer to the target, in this case facet joint. By applying that pressure over that facet joint, you'll bring that light as close to that joint as possible, bearing in mind that the patient's comfort needs to be taken into consideration here. Tissue compression essentially limits blood from the underlying tissues, and it decreases the vascular absorption by hemoglobin, thereby enhancing penetration depth. So this chart is just basically showing you the wavelength on the bottom and the cell absorption on the other axis. And we know that the key target for laser therapy is an enzyme called cytochrome C oxidase, which is one of the electron transport chain enzymes. And we also know that blood, specifically hemoglobin, is a fairly powerful photoacceptor. So if we displace as much blood as possible around that area that we're treating, we'll minimize that absorption by hemoglobin. The other thing you should be aware of is when you're using the laser probe portion of the treatment, it should be directed at 90 degrees to the surface to enhance penetration and minimize reflection. On the right, you can see that probe being held at an angle to the tissue. If that's done, actually a lot of that light will reflect directly off the skin and thereby minimize the light that's actually going into the tissue itself. One effective way of treating the paraspinal muscles, and say, for example, in the facet irritation and neck pain, say the posterior shoulder girdle muscles, is to use large arrays of LEDs, for example, that our equipment takes advantage of. So what we're looking at here is a large surface array. In this case, it's red light, and it's draped over and makes contact with the paraspinal muscles and, say in this case, the traps and levator scap and so forth. So you can actually treat a fair amount of tissue in that area without actually using the probe. Now, of course, we're treating more superficial tissue here, but the biggest advantage is the fact that it's hands-free. So this is held in place with a specialized weight, and you can actually walk away from your patient and adjust other patients while that patient is receiving laser therapy. Okay, I want to talk a bit about some research, specifically a paper out of South Africa. Excuse me. This paper was in JMPT and a couple years back, in March, April 2011, or a few years back, I should say. They looked at patients that had cervical facet joint pain of greater than 30-day duration, and then that was about 66 patients. They divide them into 3 treatment groups: ones that received chiropractic only, ones that received laser therapy at 830 nanometers wavelength only, and then the combination of manipulation and laser therapy. They only did 6 treatments over 3 weeks. So actually not a lot of treatments. And let's take a look at what they were looking at. Subjectively, they were trying to measure VAS, or numerical pain rating scale, looking at NDI, or neck disability index. Objectively, they were measuring range of motion using the CROM and baseline digital inclinometer. Okay, so those were the different factors they were looking at. And as far as results go, what you're looking at here is in blue is after the first week, in red is at the 4th week at the end of the treatment duration. And you can see at the start the pain scale being 6 for all the different 3 groups. And at the end of the 4th week, manipulation went down to a 4. Using laser therapy only went down to 4. And combined chiropractic and laser therapy, the pain levels went down to a 2. So again, a nice clear example of combining the 2 types of treatment having a better all-over effect. If you looked at the neck disability index, again, the starting point for the 3 groups were in and around the high 40s to low 50s. And after treatment on the 4th week, the manipulation group only was around 33, 34, which was a nice decrease. Laser therapy only was about 35, again, a nice decrease. And again, if you looked at the combined care using laser therapy and manipulation, it went down to just above 20. Again, a significant improvement over just the solo treatments on their own. As far as range of motion goes, looking at flexion, again, at the starting point, where most patients had roughly about 46, 47, 48 to 50 degrees of flexion. And after week 4, you can see an improvement of that flexion with manipulation, with laser therapy, and again, the best overall improvement in range of motion with respect to flexion was the combination of both manipulation and laser therapy. Same thing for extension. You can see that over the fourth week, the improvement of extension was quite a few degrees improved over just using manipulation or laser therapy on its own. And lastly, rotation. You can see that at the week 4 for manipulation was just over 60 degrees. Laser therapy was just under 60 degrees and approaching 70 degrees with the combination of laser therapy and manipulation. Again, showing a nice example of how using the two types of therapies in combination, the results being even better. Okay, let's talk a bit about whiplash and hyperextension, hyperflexion injuries, and how laser therapy might help these specific types of problems. So a review with respect to a normal ligament and tendon. The reason why I want to bring this up was talk a bit about collagen. So we know that these types of tissues tend to be very high in type 1 collagen, up to 90 to 95%, being very strong with great tensile strength, and a much smaller percentage, anywhere from 5 to 9% of type 3 collagen, which is immature collagen and tends to be weaker, less tensile strength, and not as resilient. And the remainder of the tissues consists of cells. One of the highest profile cell there are fibroblasts, which of course help to secrete collagen. So how does laser therapy affect ligament and tendon damage? Well, first of all, let's take a look at normal. This is an electron micrograph of collagen. You can see the fibers are relatively thick in alignment, so they're all parallel to each other, providing as much strength as possible. So that's what a normal ligament would look like. In a torn or damaged or sprained ligament or tendon, you can see the collagen tends to be more haphazard, not very well aligned, much thinner, and therefore not as strong or as resilient. Okay, so remodeling of damaged ligament can sometimes take as long as a year or even longer, and oftentimes incomplete, and oftentimes with a higher percentage of type 3 collagen, and as this diagram shows you, disorganized alignment. So this one at the bottom right is showing you a ligament that's actually now much weaker and more prone to being re-injured. So what does laser therapy, or how does laser therapy benefit these types of injuries, specifically in the neck? Well, we know that it can increase type 1 and decreases type 3 collagen from the research, thereby improving tensile strength of the repaired ligament. It increases the thickness of collagen fibrils. It decreases remodeling time, thereby accelerating the healing process. Can increase the collagen organization. So the references are below for all these different points. Again, this is taken from research that's peer-reviewed research over the last 5 to 10 years. So next I want to show you a really interesting paper. Now I know, of course, the Achilles tendon is nowhere near the neck or the back, but I want to just show you this because I thought it was amazing to show the differences between a typical form of treatment that a physician might recommend for a tendonitis condition. On the left is a control rat's tendon. Okay, you can see it's nice and white and shiny, kind of has lots of sheen, nice and healthy. On the right is a rat's Achilles tendon that has been induced to have tendonitis using an enzyme called collagenase. So this paper basically looked to see the differences between using laser therapy, a control, and using Voltaren or diclofenac sodium, which is one of the most common types of over-the-counter and prescription anti-inflammatories. Ones which, by the way, many patients would use for lower back pain or neck pain, specifically the Voltaren rub, that many patients probably that you have are using those on an over-the-counter basis. So the results at the bottom left is the tendon being used with sodium diclofenac. You can actually see that there's very minimal healing occurring, lots of swelling still, lots of inflammation. If we look at the tendon that was treated with 1 joule of 830 nanometers of laser therapy, you can see it's actually almost returned to normal. Still, it's maybe slightly swollen, but significant. I would say probably over 90% healed, going back to that resilient and nice sheen of the collagen. What's interesting to note is if they used a slightly higher intensity of light energy, that being 3 joules for the rat, you can see that there is some healing going on in the 3 joules, but you can still see there's a fair amount of inflammation and swelling going on. And so it's not healed nearly as well as the 1 joule. And the reason why I brought up these series of slides, I wanted to tell everyone that's listening up, is that light therapy is very much a dosage mediated type of treatment. If you use too much light energy, then you can see at the bottom right here that the results aren't nearly as good as having an optimum amount of light to actually accelerate the healing process. And what's I find really efficient and very efficacious in our type of equipment is that the dosages are all geared towards a condition. So the protocols that we use that are in the software and that we train our users to use is to try and optimize the energy to induce as optimal amount of healing as possible. And again, avoiding excessive treatment or excessive dosage or minimal dosage to therefore not get as good a result. And this is just one example to show you how important it is to make sure you get the dosages and other parameters correct in order to have the optimal results. Okay, so next I want to talk a bit about muscles. So how does laser therapy affect, for example, a spinal muscle injury? Well, as a review, let's just talk a bit about how muscle cells are repaired. So at the top left is an example of a muscle fiber with satellite cells or myosatellite cells that typically are quiescent until there is an injury, in which case inflammatory cytokines and other chemical mediators will actually stimulate the satellite cells to start to multiply, and those satellite cells will migrate to the area of the damage or actually form new cells, new myofibers themselves. So that's a typical way that muscle cells are healed. Okay, so what does laser therapy do in this scenario? Well, we know that laser therapy increases the number of macrophages. So macrophages are responsible for the removal of necrotized parts or dying parts of the muscle fibers and formation of the connective tissue scar. So this will actually enhance the repair and accelerate the repair of muscle cells. Laser therapy can also increase the activation of satellite cells. This is really important because if you increase satellite cells, you increase the ability of that torn muscle to be repaired or actually regenerate new muscle fibers. And I want to show you a really interesting paper that actually displays that. This paper was done in 2002. It was entitled Low Energy Laser Irradiation Promotes the Survival and Cell Cycle Entry of Skeletal Muscle Satellite Cells. So again, what they looked at were muscle fibers from mice, and they measured the number of satellite cells per fiber. So here you're looking at the control. It's hard to see, but every so often you see a black speck. That black speck is actually a satellite cell. So they measured the number of satellite cells per length of the muscle fibers, and then they treated these muscle fibers with laser therapy. And you can see quite clearly there's quite a few more satellite cells on the laser treated muscle fiber compared to the control. Overall, what they noticed was about a 4-fold increase in activation of satellite cells in a muscle fiber. So again, if you use laser therapy over damaged muscle tissue, you will enhance the ability of the muscle satellite cells to regenerate and repair the damaged muscle tissue. So again, a great way to enhance and accelerate the healing of muscle strains. Okay, next a paper. This is done by Roberta Chow. She's a physician and MD out of Australia. And Roberta Chow is well known in the field of laser therapy, specifically because she had a paper published in The Lancet, which is one of the physician's main journals, a world renowned journal for physicians on neck pain and laser therapy. This isn't the exact paper. This is a different one. And she was looking at the use of 300 milliwatts, 830 nanometer laser on chronic neck pain, and it was a double-blinded RCT placebo-controlled study. So it was a great way to actually show the differences between controls and laser therapy. So she designed a study. She's looking again at chronic neck pain, either unilateral or bilateral, in nature of greater than 3 months, 90 subjects, excluded any patients that had serious conditions or other issues that might bias the results. Patients were randomly allocated to either laser treated or placebo laser, and both the patients and the technicians were blinded. And again, she used 830 nanometers of light. That's exactly the wavelength that we use here at Bioflex as well. And using a pressure contact technique with perpendicular orientation. And again, I talked about that a little about that earlier. So let's take a look at the design. Essentially, they treated up to 50 tender points on these patients laterally over the paravertebral tissues. They treated the articular pillars and laterally over the posterior shoulder girdle muscles to the AC joint, the SCM belly and insertion, and both at the sternum and the clavicle. So depending on the patient, these were the types of points that they treated on them. So the outcome measures, they were looking at the VAS on the 10 centimeter scale, and secondarily they were looking at things like quality of life questionnaires and other types of questionnaires to see how they were coming along. And here are the results. So the mean VAS pain score improved by 2.7 centimeters in the treated group and worsened by 0.3 in the control group after the 12 weeks. So the patients started at roughly about an 8, and after laser therapy, the patients went down to just above a 5. So she concluded that using laser therapy of this wavelength and this power provides clinically relevant benefit in the management of chronic neck pain as a monotherapy. She noticed low adverse effects, and of course it was relatively easy to administer. What I should note is that Roberta Chow, when she went on to do her Lancet paper, she actually found that her chronic neck patients had relief up to 22 weeks post their last laser therapy treatment. And there's lots of reasons why that laser therapy treatment lasts, but it's just important to understand that this type of therapy can have long-lasting effects in your patients. So again, it's another advantage to using it on a day-to-day basis for your neck and back patients. So let's now look at back pain. So I mentioned earlier I was going to talk a bit about nerve compression. And again, this is all a review for you chiropractors out there as far as the signs and symptoms of radiculopathies and nerve-mediated pain. We know as a dermatomal, pain is severe and deep and constant. The extremities tend to be worse than the actual lower back area. It tends to be worse after rest. And the Valsalva maneuver is often positive. So different causes and mechanisms for bulging discs or extrusions or sequestrations, as well as degenerative disc disease, as well can be have an impact on compression or inflammation around the dorsal root ganglion and the nerve roots. So how does laser therapy impact the healing of nerve cells? Well, for that we need to understand some of the basic mechanisms of laser therapy. What you're looking at here is the bilipid layer of the mitochondrial wall, and specifically you're looking at some of the enzymes of the electron transport chain. And the very last enzyme is ATPase. The second last enzyme is cytochrome C oxidase. In a inflamed state, so if you have damaged and inflamed nerves, you actually have an increase in intracellular nitric oxide. Nitric oxide is known to bind to cytochrome C oxidase, thereby inhibiting the ability of the enzyme to act as a proton pump, and thereby decreasing the ability of ATP to be produced, causing cellular death, in this case nerve cell death, and a decrease in metabolism. If you add laser therapy, laser therapy actually displaces nitric oxide from binding onto the cytochrome C oxidase, allowing oxygen to rebind back onto the enzyme, thereby improving the efficiency of the proton gradient pump, increasing levels of intracellular ATP, and therefore having a whole cascade of effects, everything from increasing protein production, metabolism, cell turnover, repair, and so forth. So that's really the key, how laser therapy can help improve nerve cell repair and essentially via nerve cell metabolism. So again, this is just another pictorial just to show you that electron transport chain and how it all works. And again, that's just a review. So specifically, we're most interested in the inner mitochondrial membrane. Okay, so again, just a bit more in depth, how this is working is, again, this is a cytochrome C oxidase enzyme. You can see how nitric oxide is binding to a copper or Cu subunit within that enzyme, thereby blocking oxygen from binding and limiting the ability of that enzyme to form a proton gradient pump. Now, if you add red light or near infrared light, so typically in around the 660 nanometer or 830, 840 nanometer range of light or wavelength, you can see that that light actually is able to disassociate nitric oxide from the copper, allowing oxygen to rebind back on, combining with hydrogen or combining with water to increase the ability of respiration to occur in ATP by increasing the proton gradient pump. So that's really the basic mechanism or the cellular mechanism how light therapy is going to have an impact on nerve cell metabolism and nerve cell healing with respect to compression of the nerves. Okay, so what you're looking at here is the ability of laser therapy to stimulate migration and fiber sprouting of neurons. And laser therapy develops large cell neurons with dense branched interconnected network of neuronal fibers. This work was taken from Shimon Roshkind from April of 2009. If you're looking at the top, you can see the control neuron, and the neuron that's treated at the bottom with laser therapy. If you look carefully, you can see a lot more sprouts or branches of the neuron itself. And again, this is important in the repair process of nerve damage. So next, I wanted to show a bit more research by Roshkind. This is in 2009, and what you're looking at here is a control series of a group of neurons on the left and laser-treated neurons on the right. And what I want to emphasize here is to show that laser therapy can increase Schwann cell proliferation and myelin formation. So the neurons on the left, you can see the diameter is much smaller, so less myelin formation. And you can actually also see less cells within the actual neurons themselves. So by decreasing the white blood cell infiltration, laser therapies also help, obviously speeding up the inflammatory process. So a few treatment tips with using the laser therapy and lumbar nerve issues is we want to make sure the depth of the target tissue is reached. So we need to make sure that you have the laser therapy over the area for long enough time in order to have a therapeutic effect. And again, the longer you hold the laser probe overlying the nerve issue, then obviously the greater the depth that that laser light can penetrate, and therefore that greater the therapeutic dose to the level of the disc herniation or the inflammation around that nerve root. So when we have clinicians for the first time learning about laser therapy and trying to understand why that light is on that lower back for so long, it really has to do with the factor of the depth of the tissues that you're trying to treat, in this case, say nerve root compression. And of course, that can lie significantly deep in the lower back, up to maybe 5, 6, 7, 8 centimeters, depending on the muscle and adipose tissue. So it's really important to make sure the light is on there long enough to have that therapeutic effect. A few other treatment tips. You need to, again, make sure that the light is focused on the target tissue. So specifically, you want to make sure that the light is angled away from the paraspinals, so in the lateral aspect of the paraspinal musculature, so you can get as close to that disc herniation or that irritation of that nerve root as possible. If you treat directly over the paraspinal muscles, then a lot of that light will be absorbed directly by the muscle, and you'll minimize the ability of that light to actually penetrate and get right into that nerve root area. Make sure you use the laser therapy at several points over the nerve, causing an additive effect. So you want to treat directly over the, say, sciatic nerve. At the same time, you want to treat the pathway of the sciatic nerve as it follows down the leg. You'll find that overall you'll have a much better effect. Okay, so let's move forward to the last portion of the webinar. This has to do with clinical guidelines. It's going to talk a bit about clinical guidelines, why they're important, and then some examples where laser therapy can actually be helpful for certain conditions that we talked about earlier today. So we know clinical guidelines are documents that are created with the aim of guiding decisions and criteria regarding the diagnosis, the management, and the treatment in specific areas of health care. Our role as clinicians is to make sure we keep up with clinical guidelines so that we know what treatments are available and maybe perhaps newer treatments to make sure our patients are getting the best care possible based on scientific evidence. So the Bone and Joint Decade, sponsored by the World Health Organization in 2000-2010, and, specifically did a task force on neck pain and its associated disorders. And they put out a statement with respect to treatment of grade 1 or grade 2 neck pain after a motor vehicle collision. And the research they found that indicated the best efficacy for treatment included things like exercises, mobilizations, manipulation, analgesic acupuncture, and low-level laser therapy. Those were the only types of treatments they found enough evidence to provide at least short-term relief of neck pain without trauma. So again, when you're looking at other types of modalities, for example, maybe ultrasound, maybe interferential current or TENS or shockwave or what have you, none of those actually had enough randomized controlled trials to be able to conclude that they should be included with your treatment of these types of patients. So again, if you don't have laser therapy and you're treating neck pain or back pain, I would implore you to at least look at that as an option because they have many benefits, as I've already discussed, and you can see the evidence is starting to steer towards the use of laser therapy as well as the standard types of treatments that you typically do already. The Ottawa panel looked at patients that were being managed for rheumatoid arthritis. Now, this isn't specifically for the spine, but it can be translated to the spine as well too. So the panel made the following statement regarding laser therapy. They actually found enough evidence to say that there's anti-inflammatory and analgesic effects, that it can enhance regional microcirculation, that it can reduce exudative and infiltrative fluids, and it can actually help regenerate damaged synovial membranes. So the Ottawa panel came up with some conclusions. Specifically, in this case, they're talking about the foot and the knee. But again, you can sort of correlate this to other areas of rheumatoid arthritis in the body. They found there's level 1 evidence using randomized controlled trials for grade A for pain at 3 months, which is a clinically important benefit. Grade C for function, tender joints, muscle force, and range of motion at 3 and 6 months. As well as they felt it was appropriate to use with patients with chronic rheumatoid arthritis. The British Society of Rheumatology also looked at laser therapy specifically and rheumatoid arthritis, and their objective was to assess the quality of guidelines that have been published in peer-reviewed literature concerning the role of physiotherapy and the management of patients with RA. And they concluded that there was good quality evidence exists to recommend and support the use of low-level laser therapy. Okay, well that's it. I do appreciate everyone joining up for today's webinar. Just want to remind everyone that we have a masterclass coming up on the extremities called Extending to the Extremities. It's on Saturday, June the 14th, and you can register at Eventbrite or extremitiesmc.eventbrite.ca or go to our website for more information, bioflexlaser.com. We also have a masterclass on wounds and dermatological conditions on September 27th, 2014. And just a little shout out there if you want to join our Facebook group or LinkedIn group, or you can see other videos on YouTube. You can go to our YouTube page. And if you'd like to have any further, if you have any further questions, you want to communicate with me, my email is david@bioflexlaser.com. And again, our website is worldwideweb@bioflexlaser.com. Again, I appreciate everyone joining up today and hope to hear from you soon. Take care.